You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what's new in hair transplant surgery? A lot has happened. And with us, we have one of the most experienced medical doctors in hair transplant in the country. He's been doing it more than 30 years, Dr. DeYarman. Dr. DeYarman, welcome to the program.
Thank you. Glad to be here.
Now, you've been doing it more than 30 years, right?
Yes, it's just been wonderful, too. I just learned so much over the years and keep learning all the time.
Now, your hair is not a hair transplant.
No, it's not.
And it looks good.
Well, thank you.
Do you do like anything, like a little bit of PRP or any of the injections?
I do some stem cell therapy.
Okay.
And some PRP.
Now, you have an interesting story. You got out of medical school many, many years ago, practiced, I guess, as a regular physician for just a couple of years, and then got into hair transplant.
That's right.
Is that right?
That's right.
Why?
Well, I had a very busy practice in Escondido, and I needed help, and I contacted a guy I went to school with, and he said yes, he'd come out and join me, and in the meantime, he says, we ought to learn how to do hair transplants. I said, what do you mean? He says, well, there's a guy here in Atlanta that will teach us. His name was Dr. Chambers.
Okay.
So we did it, and we opened the second office in San Diego in hair restoration.
So you liked it, like right away. Like you said, boy, I think this is it.
Well, I liked the fact that I could do surgery. I liked doing surgery. I liked the fact that it was artistic, you know, creating something, and the pleasure that you give to people when you give their hair back, it's amazing. They're so grateful for this. So it's a good thing, you know, and I got into it more and more. Why, one day I said to my partner, I said, I just don't like hair or general practice anymore. And he said, oh, I don't like doing hair transplants. So we did. He just took over the family practice. I went into hair restoration full time, and I've been doing it ever since.
So all you do is hair?
That's all.
Now, people need to know. Look, I'm not trying to endorse you on the show. I'm just asking the questions. But I've met some of your patients. I've seen your before and afters, and it is good work. And one of the reasons we invite you on the show today, in fact, it's a more controversial topic. You know, on our show, we try to stay positive. But as you've let me, help me understand that there's a lot going on in the hair industry that people need to know about.
That's right.
That it's not that there's a lot to it, that it's very complicated. Is that right? Is that fair to say?
That's correct.
What are the age ranges of people getting hair transplants today?
Well, from 18 to 80, all right? But the most common age bracket you'll see is less than 30 years of age.
Okay.
And those gentlemen are so desperate that they'll do anything, you know? And if you lead them to believe that a hair transplant is the best therapy, that's what they're going to do. And it could be a mistake.
Is that right? Mm-hmm. What do you mean a mistake?
Well, the mistake is they should not have been transplanted to begin with. But because of the FUE, the follicular unit extraction, where we take out very small grafts, they're able to do, let's say, a small case on this patient and put in these small little grafts in the area that they're thinning. They're not bald, they're just thinning. Well, the problem is that over time, these little grafts will stand out because they're not single hair grafts.
So they're starting to recede
behind
more,
it.
And now they have like doll-looking hair coming out of their head?
Exactly. That's what's going to happen. And so if you do hair restoration, you know that in the front of the man's hairline, they have to be one hair transplants. They can't be 2 or 3 or 4 hair transplants. It'll look pluggy, like the old transplants used to be.
So a lot of 30-year-olds are going in by inexperienced guys or guys that are differing in philosophy from you.
That's right.
And they're getting hair transplants just in the receded area.
Yes.
5 years from now, those look fake, like doll hairs.
Exactly.
Is that right?
Yes, because hair loss is for the rest of your life.
So you don't do it that way?
No.
So that same 30-year-old, what are you going to do?
No. I don't like transplanting guys under 30, but I have. Because these guys are so hung up on their hair loss that you need to do something for them. So I have found that if you just do single hair transplants in the frontal hairline, you're not going to hurt them. And you're going to.
But that's tedious work, though, I've been told.
Oh, yes.
Single hair transplant.
Yes, you have to have microscopes. You got to be able to dissect these hairs out because you're going to transplant these little hairs one at a time at about 50 hairs per square centimeter. Now, that's a lot.
Yeah, okay.
You know, and you're going to create a natural-looking hairline.
And that's not being done?
No.
That frustrates you. We were in the green room. I mean, you were pretty fired up
Well,
about what's going on today in hair transplant.
yeah, because the guy that spends the most money in advertising is the busiest. That's what it amounts to.
Okay.
And yet they aren't doing the best work.
You told me, I hope we can tell this story. You told me that you went to a well-known plastic surgeon in San Diego. I don't know him, but you were going to team up together because you have the robot that does, the hair transplant, that you went to observe what he's currently doing for his hair transplant patients. And you, tell the story.
Well, I just couldn't believe it. It was like I was watching somebody doing a transplant back in the 80s. The history of the transplant started off with big 4mm grafts or plugs, and they were placed in a 3.5 millimeter hole. Well, what you did, you compressed the hairs closer together than they naturally were, and you created this toothbrush effect, which is not what you want in as far as appearance is concerned. So the grafts got smaller and smaller and smaller till finally they figured out, well, let's just cut a strip of tissue out and dissect out these hairs from this tissue. And that was the origin of what we call the micro mini graft.
Okay.
The micrograph was a graft with 1 to 2 hairs in it, and the mini graft was a graft with 3 or 4 or 5 hairs in it. And that's the way we did it for years until the 90s. And in the 90s, that's when we started the follicular unit transplant. And that was really the big thing that changed.
That's individual hairs.
Right, as a result of looking at hair through a microscope. Because prior to that, we didn't look at the scalp with a microscope. We just looked at it with loops, thinking that the hair...
But this guy that you went to in San Diego is doing it without a microscope.
That's right. That's the first tip-off.
So you don't like that? You think that's terrible?
You can't do a proper transplant without a microscope. It's impossible. I mean, you think, well, I can see what hairs are coming up through the skin. But you don't realize that there are hairs that are in what we call a telogen phase. It's not growing hair up through the skin, but it's still alive. The bulb is still there. And you don't realize it, and you think that's a one-hair transplant, and lo and behold, 2 hairs come up out of there.
Okay.
See it a lot.
So you got to have the microscope.
You have to. You can't.
So when you saw what he was doing and you were going to team up with him, what? You just think, what? I'm going to pass. I'm not going to get involved in this. This is old school.
What I saw was, a need that maybe we could start working together.
All right.
Because the handheld FUE has a place with the robotic FUE. Because the robotic FUE works faster. Your
robot, that means the robot you're using, the ARTAS robot.
The ARTAS robot will extract up to 1,500 grafts an hour. Where if you're doing it by hand, you're lucky if you get to 500 an hour.
Okay.
So
is that one of the reasons why you feel like you give a better hair transplant? A more natural looking, more dense or thicker?
I think the key for the robot is the fact that the grafts are always almost perfect. Okay. And they transplant very well, and the patients are very happy. The other method, if you're just doing standard FUE without dissecting out the grafts, you're not going to create a natural hair pattern. Okay. And so I'm saying to myself, why don't we work together? This doctor and I could be doing the robotic part of it, and then he could do the individual handheld, because the robot can't get up high or it can't get low. So we'll take the robot, extract the 1,500 grafts, or we could easily do 2,000 without any problem, and then take and do another 500 or 1,000 by hand. Patient gets more grafts, everybody's happy.
So with this doctor, you're going to work with him. You're going to team up together with the ARTAS.
I'd like to. I hope to. I hope to do this with all the doctors in San Diego, because I have the only robot. And the last thing we need is more robots in San Diego, because it's a very expensive piece of equipment.
This ARTAS.
Yes.
Okay.
Yes.
ARTAS is the brand of the robot.
That's the brand.
They're the leader, right?
They're the only robotic hair restoration device in the industry. Okay. And it's amazing what they've been able to do with this device, and it just keeps getting better. I remember since the last show that I did here, how much better the robot is now. It's so much faster. Oh yeah, it's amazing. And it stands to reason, because it all is software driven. The better the software, the better the machine.
So is it a good time to be going bald?
Well, it's never a good time to go bald, but it's a good time that we can do something about it. Okay.
I mean, the results today are better than 5 years ago, 10 years ago?
Absolutely. Oh, yeah.
And better in the hair world is what? Just a natural looking, thicker
Well, there's
result?
so many things that are doing now that we didn't do 5 years ago. I think the biggest thing is the stem cell transplants. We're combining PRP, which stands for platelet-rich plasma, your own blood that we extract the platelets from, combine that with stem cells that we get from cord blood, and we inject that in the scalp, and it's amazing.
It's working.
Oh, it's unbelievable. The hair transplants come in twice as fast and thicker, and the patients that we do on a standalone therapy, for example, for women, it's really been hard to do much for women over the years because they thin all over. This has been the answer for that, because you inject it and their whole scalp, the hairs will thicken up. I always ask is how well is it going to help me? Well, it helps everybody. I've never seen anybody get worse. Everybody sees an improvement. The degree of improvement is what's different.
Okay.
I mean, there's some guys I've done, it's unbelievable that, it's hard to believe when you see it.
Now, I've done some research and talked with you a lot about this, and it seems, and if I'm missing something, you have like this 7 things that you attack the thinning hair with. PRP injections, stem cells separately. You have the robot, the FUE procedure. You have strip surgery available to you, lasers, medication therapy. So it's a combination of procedures.
Absolutely.
Today. Is that right?
Yes. I mean, you got to use everything out there.
Are you using every single thing that's new in hair transplant?
Oh, absolutely.
So you're using everything?
Absolutely, yeah. You have to use and offer everything that's out there. I'm always amazed how each year something new comes along. It never ends.
Now, one of the biggest companies that we see a lot of advertising on, and you've told me how this works, and I'm going to summarize it, that they go in and they go to the plastic surgeon, the dermatologist, and say, look, we'll bring in a team and and you can get in the hair transplant business. And it's easy to do, et cetera. You say it's not the doctor's fault, it's the salespeople's fault that are making hair transplants sound easy.
That's right.
Can you elaborate on that?
Exactly.
What do you mean by that?
Well, they'll come into a doctor. Plastic surgeons are the best, or cosmetic surgeons.
So this is like the inside scoop you're giving us about how hair transplants are normally done. Okay.
Well, how they're selling this concept.
Okay.
And what they're selling is a machine that they train technicians on how to operate, how to utilize it. And so they'll go to the doctor and say, would you like to start doing hair restoration or hair transplants in your office? Well, oftentimes they say, well, no, I don't want to do that. And they'll say, doctor, you don't have to worry about it. We'll supply everything, the technicians and the machine, and you just give us the room and we'll do the procedure.
They just have to work under a medical doctor's license.
Exactly.
Interesting, okay.
Exactly. So that's what they've done. Well, the doctor sees it's a relatively simple procedure. It's not surgically complicated. It's just the fact that you're working with very small pieces of tissue. And if you've never done a hair transplant, you don't realize that you've got hairs that are growing in different arrangements as far as number of hairs per graft. Okay. And so without knowing it, you just, they treat the techs know they can do what they're taught, and they have this machine, they go through the back and take out all the little grafts, and they then put them in a little cup and they then take them out of that cup and put them in the top where you transplant them. There's no grading of the grafts, no counting of grafts.
Does that bother you?
Yes, because
you've been doing this more than 35 years. So guys breaking into the business, because the patients must be happy though. Some guys must be happy with this. But are you saying that they don't know how it could be?
They don't know what it's going to be in the future. That's what I'm saying, because they don't realize what they're doing to this person.
So this 30-year-old, 35-year-old guy, this other method, you're saying, is setting them up for an odd look in like 5 or 6 years?
They're going to be forced to have to do something.
They'll do another one.
Yeah, they'll have to. Now, how are you going to make the second one look better than the first one? That's where you got to start knowing about hair densities and number of grafts and number of hairs per graft, things like this. You got to know this.
So this is a complicated thing.
It's more than people realize, And I'm at the point now that I'll offer my robot to every doctor in San Diego or any doctor that wants to learn hair restoration. And we'll partner up together and do these procedures. And everybody wins.
Is that right? So let's talk a little bit. Okay, so I'm seeing, look, on Facebook, I'm seeing dermatologists, I'm seeing a lot of people that are pushing PRP injections or stem cells injected into the head. I'm seeing laser therapy, all of these things. So you're doing all that, but you're combining it with the surgery.
Well, if I do, I call it a standalone therapy. Stem cell therapy or PRP therapy or together, that's a standalone therapy. That doesn't have any surgery involved.
Okay.
When I do surgery...
But can they get good results with that?
Absolutely.
Really?
Oh, absolutely.
I mean, hair grows back?
Absolutely. See, when you lose your hair, it miniaturizes, which means the hair shafts become thinner.
Out of the front, is that right?
Yeah.
Okay.
Yeah. Or if you look back in the hair in the back, especially in women, if you look closely, you'll see that some hairs just look thinner.
Yeah.
They're not as thick as the other. You want that big, thick hair shaft. That's the healthy hair. Well, when you stem cell therapy, you're going to activate these miniaturized hairs to start producing a shaft of hair again, a terminal hair. And lo and behold, they appear to have more hair because the hairs all get thicker.
Okay.
And that's what happens here. And I mean...
What about the dormant hairs? Like some of the hairs that are just about to die out, does it reactivate those hairs?
It depends on where you are in the cycle. If it's too far gone, they go ahead and die out, but then they'll regrow again. You know, every hair follicle just doesn't stop growing. It goes through a process of the growth period becomes shorter and shorter and shorter. But it starts off about 7 to 9 years long before that hair actually falls out. But in 3 months, it'll start to grow again.
So if you catch it early, like a 30-year-old catches it early with some of these stem cell therapies, could it be possible they could keep the hair they have?
Well, yeah, the real question is how long will it last?
Now, what about with the medications that you're recommending?
The finasteride, it's interesting. When they did the studies, after 5 years, they quit studying it. So you always see, well, it lasts up to 5 years. But if you've been doing this long enough, you'll see that it just keeps right on working. So if you get a positive result with finasteride, stay on it.
That's the medication.
Yeah, that's the pill. That'll stop your hair loss, and that's the whole key here. If we can just stop it, then it's much easier to treat. If you're chasing it, you'll never get there, you know?
Now, I spoke to another medical doctor about the medication, and he was convinced for most people it can stop the hair loss.
Oh,
right?
Absolutely. Oh, yeah.
And I thought, well, why isn't everybody taking it? Why not have a press conference and say, look, this could stop hair loss? And I said, look, I'm always worried about losing my hair, but I read it's like a 1% chance you're going to have sexual side effects. He told me he's never met anybody with those sexual side effects. What is your take on this whole thing? Because that is a fear, obviously.
It is, and everybody goes on the internet. They read about all these side effects, and that they get frightened. I tell guys, look, most guys don't have side effects, so why not give it a shot?
Have you met guys with side effects?
Oh, absolutely.
Okay.
Oh, yeah.
But you'll know right away, right?
Yeah,
You just stop taking it.
Exactly. That's the key.
That's what I was thinking.
But I tell guys when they start it, if you have side effects or things don't feel, call me first. Don't just stop it, because there are things we can do in dosing you to get you where you can tolerate it and still get you the positive benefit. So, it's like, it's the best thing out there with medicine, and if it works, why not give it a shot?
Do you take it?
No, but do you take it?
I do take it, yes.
There you go.
And I haven't had any of those side effects.
Yeah.
And everybody that I've told to take it, because I've told a lot of my doctor, the people that come on this show, and nobody is having any sexual side effects. And I wish I would have heard about 10 years ago.
Yeah.
I don't know where you were 10 years ago. I don't think I knew you 10 years ago. But you were on the show quite some time. Let's talk about results for a minute. You say, moving into results, that for some patients, they get their hair back and their whole life changes. What do you mean by that? Or give me an example of what you're talking about.
When you get guys under 30 and they're losing their hair, it's a completely different scenario than a guy that's 40 or 50 years old losing their hair. And the young guy is not ready for it. And if he's 18 or 19, it's devastating. And I had a patient one time that was like this. He was losing his hair, and his mother you know, said, we got to do something because he's not wanting to go out. He's just become very much of an introvert, you know.
Okay.
So I said, all right, but we got to be very cautious here. I don't want to, we got to watch the hairline. You can't bring it out too far because he can't look 18 the rest of his life. So we got a game plan and we did it, and the hair grew in and it completely changed him. It was unbelievable. And this was many, many years ago, and he still is a patient of mine today and very happy. He's done very well. In this business, every day we see a positive change. When you start giving somebody back their hair, they're so grateful for you that it's unbelievable how everything changes. Everything's up and happy, and you know, everybody wins.
So the 30-year-olds, they don't want to look younger, they just want to have their hair back.
Exactly.
And the 50-year-olds,
they want to look younger.
They want to look younger. And so is it, so is it a mix? I mean, is it mostly the 30-year-olds that are coming in, or are you getting more 40 and 50-year-olds coming in? And how old can you be to do this? Lots of questions there. Go ahead.
All right. Well, my age group goes from 18 to 80. 85 is the oldest patient I've ever done. You know, everybody's different. I mean, everybody's concern is different. You know, it always amazes me when a guy's completely bald and he comes to your office and you ask him, where would you like to have the hair transplant done? What part of the head? What do you think they always say? Most of the time.
The front.
No.
What?
Back here.
On the back.
The back. Go back. Because they're so self-conscious of that, quote, bald spot.
Okay.
That I used to call it the 7-Eleven stop. You know,
okay.
You're in the 7-Eleven, you're paying your bill, you look up and see the monitor. Who's that bald guy up there? Oh my God, it's me. You know, that's when you didn't realize it. And they just don't like it. But you have to explain to them, nobody remembers the back of your head. I mean, you do a transplant for the frontal view of what the people are going to perceive.
But you do that too.
You can, but you kind of discourage against that.
Really?
Yeah.
Because that's going to save the money as well.
Exactly.
Interesting.
Now, when you do the crown, let's just go for a thinning look. Don't try to get full head of hair back there. You'll be disappointed. You'll spend a lot of money, and it's not necessary.
Interesting. Okay.
These are the things that I've learned over the years doing this, that I'm more than happy to share with other doctors in this town if we would just all start to work together. It would be much easier to treat.
So I see commercials where a guy gets his hair transplant. You know, he's hiking and running and swimming and dating, and he's at Machu Picchu and he's at Mount Everest. I mean, all these crazy things. Do you see that kind of thing? Like you give a guy his hair back?
Oh, absolutely. I mean, these guys are so happy for what you've given them. You know, they're so excited. Their whole life changes. You know, they feel younger, they act younger, they look younger. So, yeah, why not?
Is that right? Now, you're not a fan of toupees, because I still see them all the time.
Well, I think there's a time and place for everything. That's like in hair restoration. What surgery should you use? It depends on what you're treating.
Okay.
Everything's got
So
its
what are your
place.
thoughts on how important hair is?
Well, it's important to the individual.
Okay.
You know, so you have to ask the patient, if you're concerned about this, let's do something about it. You owe it to yourself. You know, why not treat it? Why not feel better? Why not, you know, look in the mirror and be happy about yourself? These are all good things that could happen to you.
So these guys, like, what are the #1 things that they tell you that they're embarrassed about as far as their hair? On the consult, like, do they wear hats? Do they think people are looking at their hair? Like, what do they say? Like, what are their chief complaints on these consults?
I think that the chief complaint is the fact that they're losing their hair. In general, they're losing their hair. The younger guys, it's always these corners, you know, that's what they're concerned about. And they'll bring in, and you got to listen to these guys, because if you don't treat them, somebody else will. So just make sure the treatment is very conservative, don't get aggressive. You'll be happy. The patients will be happy.
So we are short on time, but if somebody's watching this and they're considering a hair transplant, do you believe that if you're going to get this done, you got to find a doctor that has a robot?
Oh, absolutely.
Okay.
Absolutely, because the guy that's...
The ARTAS robot, I should mention.
That's right. If he's got the ARTAS robot, this doctor is really serious about doing hair restoration.
Okay.
He's got all the tools, because that's what you need. You have to have all the tools available to get the best results.
So medication, even lasers, you have the strip surgery available, the mega FUE procedure, PRP injections, stem cell injections.
All those things.
Did I leave everything out?
I think you got it all. You got it all. you know, and you got to be able to do it all, because there's not one treatment going to satisfy anybody.
Now, look, I know the prices, like we said. You're very competitive. I mean, it's all about the same. So you might as well go to the guy with the robot, and also the guy that's been doing it 35 years. Have you been doing it more than 35 years?
I started in 1980.
How many years ago was that?
Well, that's 38 years ago.
38 years. And so there's a lot. So I guess when you hear these salesmen coming in saying, it's easy, that probably bugs you.
Well, yeah, because they don't understand what's involved. You know, you describe this procedure to people, you say, we're taking tissue out of the back and putting it on top. Sounds pretty simple, right? No, because this tissue that you're taking out of the back of their head, you have to inspect it under very strong magnifying glass, because you got to know what you got, what kind of hair it is, how many hairs there are. You need to know all these things.
So let me ask you a question. If you had to put a percentage, I mean, this is just your opinion here, but would you say that it's to get a great, thick-looking, natural-looking head of hair transplant, that is the doctor that's doing it? Are they 80% of the result? Like it's an 80-20? Like the technology, like is it more artistry of the doctor as far as?
Well, I think it's 50-50. I
Okay.
really do. The surgical side of it is very important, that you follow some strict guidelines in the surgery. But they're, like I said, it's not complicated surgery. It's just surgery that you have to be very, you know, close to the numbers and the type of tissue that you're using.
Okay.
You know, it's all important, really.
What about financing? Do you offer finance? You have lenders that will finance these guys with hair? And do they do it? Is it common, their financing?
Oh, absolutely.
Like every day, every week in your practice?
Well, most people use credit card.
Okay.
That's what most people do.
So I guess with financing, things like that, pretty much, as long as you have decent credit,
Yes.
you can get the financing.
Yes, you can make it very affordable for people today.
Okay, good. Final message. A guy, a woman, somebody watching this, they're losing their hair, or they're driven crazy by their hair, or they're not happy about their hairline. What do you say to them?
Call me.
Okay.
Call my office. You know, call me. I can educate you on what to do, what not to do, and, you know, take care of the problem. Don't do nothing. Do something about it.
Okay, good. I want to thank you for coming on the show, Dr. DeYarman.
Thank you.
Well, and people go to your website, look at your before and afters, things like that.
You're right.
All right, thanks again.
All right.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.